Interestingly, when I was going to prepare for this talk to talk about death and the fear of dying, I actually found that in America, most people don't really fear death the most. That's number 5 on their list. The number 1 fear is public speaking, which I'm doing right now. So this talk is only for those who consider themselves to be mortal. The rest of you may not find it very interesting. It's been a bit of a paradox growing up in a religious society like India, getting trained as a medical doctor, and yet finding people think it's so hard to deal with death and dying. When I was small, my father always said, "Don't talk about dying. It's inauspicious. We shouldn't speak about it." When I named my son Nirvan, the ultimate destination for the spiritual, my father was actually not happy with my choice of name. He said it has connotations of something which is not possible for the living. So this is how I've grown up, fearing death and all the uncertainties related to it and what comes after it. So when my grandmother got hospitalized a few years back, I was totally unprepared to deal with it. Unfortunately, I was as unprepared as she and the rest of the family was. So I remember my Nanima as one of the most loving persons in my life. She has always been there for me. And when she needed me the most, I couldn't do enough. I wasn't there for her. She became sick a few years before that. We had lost my grandfather, but even then, there was the fear of dying amongst her, rest of the family, including me. So she was hospitalized with an infection after having been operated for a hip surgery a few days before that. She was increasingly finding it difficult to eat or to breathe. Everybody thought it so fortunate. Her granddaughter is a doctor. She can go inside the ICU, take care of her, oversee the treatment, and everything will be fine. But strangely, the truth was very much far away from this. At 11 p.m. in the night, when I entered the ICU, I found her gasping behind her oxygen mask, getting more distressed than before. The first thing she asked me when I entered, "Can you get me some water? I'm feeling so thirsty. I've been calling out, but nobody is listening to me." The next thing she asked me, "Can you get me a napkin? I want to wipe my mouth. I do not know where my hanky is. Why is nobody listening to me?" The nurses were busily going about their normal work. They came in between to give some injection. They came in between to give another medical treatment prescribed. Nanima was lying on the bed with 3 IV lines running, a cast on her left operated leg, an oxygen mask covering her face, a catheter inserted to drain her urine, looking very agitated, very uncomfortable, very lonely. The doctor came in to me, not to counsel me, not to comfort me, only to get some papers signed and to say, "It looks like her respiratory distress is worsening. Maybe we should start her on some artificial ventilation. We can start her on some life-prolonging, not life-saving, life-prolonging medication because her blood pressure appears to be low." He knew it wouldn't help. I knew it wouldn't help. But we went on with the charade because that's how a healthcare system is designed, just to prolong the dying process, make it more painful than what it previously was. Nobody told her the truth, neither me, nor the doctor, nor the nurse, nor any of her other children. Throughout the night, she kept on tightly holding my hand, crying out aloud to me and her son, "Save me." We didn't tell her the truth. I didn't know how to comfort her, how to provide some spiritual comfort to allay her desires. All I knew was to give her more and more medical treatment. That's what we are taught at medical school. We're not taught how to comfort a patient and help them in their dying moments. She continued to lie on that bed. The hospital kept on stepping up the aggressive therapy. After 6 days of hospitalization, Nanima died. We never gave her a choice, for we never told her the truth. We never gave her a choice on how she wanted to die and where she wanted to die. My only solace is that she died during visiting hours, when my mother was there holding her hand. She could have very easily died alone. Is that what we truly want? a lonely death bereft of any dignity and peace? On the fourth day of the morning, I heard this quoted out from the Bhagavad Gita. Never was there a time when I did not exist, nor in the future shall any of us cease to exist. I wondered whether Nanima remembered these words from the Bhagavad Gita. I wondered whether this spiritual comfort might have been more useful than all the poking and probing we gave her as a part of the healthcare system design. Increasingly, we are hearing reports of the problems associated with end-of-life care, of untreated pain, of patients lying in distress, not having their anxieties and the fears met. The IM has reported that 40% of family members have reported that their loved ones, when they died, were undergoing severe pain. 10 to 50% of diverse patient populations surveyed have reported that they were given treatment which they really didn't want, largely ICU and emergency treatment that was provided. With more and more death moving from homes to hospitals, it is really strange that when people were surveyed and told, where would you like to die if you knew that you had less than 6 months to survive, 90% opted to die at home amongst their loved ones. But our healthcare system, in its current design, is not able to meet that. We are starting to treat death like an illness, give more medicines and make it better. We are forgetting death is a certainty. It is something which is natural and should be kept as natural as possible, making the person leaving have a peaceful dying process. Increasingly, we know of medical specialties like cardiac care and neurology and cancer therapy, but we don't know much about palliative care. If death is inevitable, maybe we should try to die well. That's what's required. So what is palliative care? It comes from the Latin word pallium, which means to cloak. So the palliative care therapy is designed to cloak the patient of all the distressing symptoms he's facing as a part of the illness or disease he's suffering from. It aims to meet not only its physical pain needs, but also its spiritual and psychological needs. We are finding that increasingly countries are using multidisciplinary teams which provide palliative care not only in hospitals, but also in patients' homes. It includes a component of spiritual care as well, where spiritual needs are met by a person called a chaplain. A chaplain need not necessarily be a priest. He can be a volunteer who can be trained to meet the spiritual needs of a patient. And he meets these spiritual needs not necessarily for one faith, but for people of all faith, and even of people who do not have any religious faith. Because spirituality need not equate with religion. It is something about meeting a higher purpose in life, finding our own meaning in life. Every minute, 100 people die. In the last 10 minutes of my talk, about 1,000 people have died. It's strange that such an important thing, like a dying process, is ignored and not talked about so much as it should be. I think it's our responsibility to make sure that people who are dying are listened to, comforted, and their needs are met. Thank you.